So I think we can do just like super quick introduction and then talk about what we got going. But hi everyone, I'm Jay Robertson. If I haven't met everybody, I'm the healthcare sector lead. Although Katie really does pretty much all the work. But I work at Children's Mercy Sports Medicine there. So yeah, Brian, you go ahead if you want.
Brian Mays, I'm the coordinator of school-based health over at Children's Mercy and working in the Office of Community Impact. Katie, you want to go ahead and
I'm Dan Kane, and I've spent a lot of years in healthcare on the insurance side with Medicare, Medicaid, and commercial products, kind of primarily working, I always call it working for the dark side. Always worked on the money side, negotiating the contracts with the health plans to the providers. Dark side.
Thank you. Hey, that's noble work still, I'm sure.
Are you guys able to hear me?
Yeah, Josh, go ahead.
Sorry, I'm driving out to Great Bend, Kansas for a satellite clinic, but I'm Josh Holbert. I'm one of the cardiologists, pediatric cardiologists here at Children's Mercy, and I specialize in the exercise and sports cardiology as well.
Thank you for joining us. And then Meredith.
Hi, good morning. Meredith Cantrell. I'm a program manager for community health initiatives at St. Luke's.
Awesome. And then Katie.
Oh, sorry, I am last one. Hi, I'm Katie Amy. So I'm at Children's Mercy as well. I work for the Kansas City Healthy Lifestyles Collaborative, and I help support various initiatives, one being the KCPA plan.
Awesome. Well, thank you guys for joining us. I don't know, we might have some other people pop on here in the next couple of minutes, but yeah, today we're gonna not a super long meeting because I have a meeting. So if it goes longer, you guys can obviously keep talking without me. But yeah, we were just kind of in our last kind of full KCPA plan meeting. Well, here we got somebody new. Hi, Mel. We just got done introducing everybody. So if you want to introduce yourself to the group, go for it.
Sure. So, sorry to be late running from another meeting. My name is Mel Huddleston. I am the Division Director for Community Health here at Johnson County Department of Health and Environment.
Awesome. Thank you for joining us. And then David just jumped on. You want to go ahead and introduce yourself? Everybody else just got done. Sorry.
Okay, sorry about that. I'm David Varan. I'm a professor at family practice at UMKC at Lakewood campus. Awesome.
Thank you for joining us. Yeah, so this is the healthcare sector meeting. If you haven't been involved before, so it's one of the 11 sectors on the KCPA plan, and each sector has strategies. So one of the things that we've actually been talking about recently is kind of revamping some of the strategies, reassessing some of them, seeing if they still kind of align with our goals and plans and maybe start some new implementation projects and things that we can get going. So it's we kind of did like a pretty formal like brainstorming session to come up with these several years ago, and a couple of them I think have remained relevant. A couple we've kind of actually done some pretty good work on and might just need to move on from those, and some others probably need some reassessment. So the strategies we came up with, if you've never gotten a chance to kind of look at the KCPA plan website, there were 4 for healthcare sector specifically, and I don't know if I can. Let me see if I can share this screen.
I can share my screen if you would like.
Okay. Yeah. If you want to just put those 4 sectors up there. So they were all basically it's the outline for what we want to do with the sector and what our goals are for the sector. So Strategy 19, this cross-sector partnerships to promote access to evidence-based physical activity services. So it's kind of working with the other sectors to make sure we're getting, healthcare people involved with physical activity in the community, basically. And the one that we've kind of hit on for that over the years is Just Walk. So it's Walk with a Doc if you're familiar with that, but Just Walk is kind of more encompassing, so there doesn't have to be a physician around for that. And that one's been variably successful. Kind of depends on where we've done it and how we've done it. But UMKC has a really successful Just Walk program. Children's Mercy, we had some fits and starts, but it seems to be working pretty well with kind of the employee wellness side of it. We've had some corporate Just Walk things that we've tried to implement a few times. It's just been hard to get people to kind of take that on in a leadership role from some of the outside corporations. But that was kind of our big initiative on that, and so it's been, like I said, variably successful. But when it works pretty darn well. So that was part of that, and then Strategy 22. That was, so I'm skipping around here a little bit, but Strategy 22 was our healthcare, our curriculum sector, or curriculum implementation group, I should say. So we worked with some outside groups, and then UMKC Med School and KU Med Med School, and some with University or Kansas City University, although that kind of fell apart a little bit. But UMKC and KU Med have both kind of implemented some of that sort of lifestyle medicine curriculum, of which physical activity is a big part of that. So we've gotten those kind of off the ground and started, and that was really kind of our goal. So that curriculum sector, that curriculum implementation group, kind of succeeded. So we're kind of looking for something maybe a little bit different. We never really succeeded on some of the other healthcare groups like nursing schools and PA schools necessarily, but those are still ripe areas for implementing some of the lifestyle medicine and physical activity education. So those were, I think, our two successes. And then the Strategy 20 and 21, so increasing priority of physical activity assessment, advice, and promotion, and recognizing physical activity as a treatable and preventable condition. We had a implementation group for that, which was kind of around billing and reimbursement and stuff. And that kind of fell apart a little bit because there was not a big push by any major healthcare organizations or insurance groups. However, we feel like that has changed quite a bit. So maybe that one is kind of ripe for picking back up and looking into it harder, because of all the different things that I might disagree with on the HHS. They do seem, current HHS, they do seem to actually be promoting physical activity, at least. So maybe being able to reimburse better for education on that side for physicians and PAs and nurse practitioners could be something where we could really benefit. So those are kind of things we've done with those strategies over the last few years. So kind of what Katie and I were talking about is kind of maybe revamping those, reassessing if those implementation groups, especially maybe the reimbursement one, needs to be kind of revamped and started back up again in ways that could really help like actual practicing physicians make sure they're educating and billing properly for those things. So those are the things we talked about. It's if anybody's super interested in one of those strategies and has any ideas or any other implementation things that they think they could help kind of set up, then we are all ears and ready to kind of change up a little bit of what we've been doing. So
yeah, I'd be interested in getting back on that horse with the billable codes and get some of the payers involved, and also the state Medicaid folks maybe sit in and give us some guidance on areas that we'd have questions or, kind of leverage some of that knowledge and expertise. So,
Yeah.
I'd be love to be involved in that part.
Yeah, if you know people and especially state Kansas and Missouri Medicaid, I think that's a huge help, a huge bonus for that group for sure. That'd be awesome.
Great. And Medicare as well, and commercial
Yeah.
products. I mean, they're all these value-based, kind of the new models that CMS is rolling out. There's definitely a space for that kind of coverage. And I know I think we worked a little bit on the billable codes, and we can kind of kick that door back open maybe and then get some leverage with the folks in those areas of public health and community.
Yeah, be awesome. So we're always, David White at Children's Mercy was the one kind of leading up that implementation group, and we'd love to get him back involved. But if you have any desire to lead that implementation group, that would be great. We'd take it.
Yeah, that'd be great. And I've been meaning to reach out to him. I've kind of been off the track, and I haven't been in tune with this particular committee, and this is kind of where I like to lay and get involved. And I'll get back with him and kind of maybe brainstorm a little bit, and the next time we meet, we can kind of bring that to the meeting.
Yeah, and then maybe Katie can just get on an email thread with you guys, and if anybody else wants to be in that specific group, just let Katie know, and we can make sure that we send out all the invites and meeting stuff for that.
Hey, this is David Moran. I'd like to participate in that group too, because I've been leading the effort on remote monitoring, and we've seen some pullback from many of the insurance providers on covering that. If you hear noise in the background, just because I'm walking the golf course right now. But yeah, I'm interested in the billable side of things.
Awesome. Yeah, good job on you being out on the golf course. It's good physical activity.
For sure, walking too.
Yeah.
It's a good 4-mile walk if you're playing good, and a 6-mile walk if you're playing bad. And either way, you're a winner.
I like it. Hi, Helena. How are you?
Sorry, I was double booked. So
No worries. We were just talking about kind of reassessing some of the strategies and implementation ideas and stuff, because we feel like we've had some successes and some things kind of fell off the table. So we're just talking about maybe reestablishing the billing and coding and reimbursement implementation group, and then seeing if we can do maybe something different with the curriculum group, since it seems like UMKC and KU have at least started really implementing that lifestyle medicine as part of their curriculum. And then the Just Walk, I feel like we got 3 or 4 walks out there that are pretty successful at the moment. So we're kind of holding steady on those. So those were some of the ideas, maybe, again, either just reassessing those strategies and changing the implementation part, or totally changing the strategies or adding strategies if we needed to. So
I got bumped off a moment ago. I know whoever was speaking before about, was there a mention about wearable technologies and stuff for a minute? Did I hear?
yeah, that was David. He was talking about the wearables, and he's been working on that for a while.
Yeah, David, that's I'm interested in that as well. There are codes, and then some of this for telemedicine and downloading data, A1C and all the kind of hit points that, we run into, particularly with, comorbidities, where the rubber really kind of meets the road, and that new technology is, becoming more mainstay and changing every week. So I think that's really somewhere we could leverage as far as, understanding coverage better, billing and reimbursements, and work on that too. So David, I might connect with you.
Yeah, right. There's no question. I think the future of medicine is going to be wearables. And Dr. Dean Norbash and I have been trying to struggle with how do we get this into our curriculum. But more importantly, what we're starting to see is we want to see the wearables in people that don't have a diagnosis that covers it. For example, we want to see over-the-counter Stelo CGMs put on people that are at risk for diabetes but don't have diabetes yet. And of course, insurance companies will not cover any of that. So that's where the pushback's been.
Yeah, for your preventative care. Okay. Yeah, we could maybe uncover some policy or see what's not there that maybe needs to be, and kind of explore that avenue for, understanding what policy is now, and leverage what could what outcomes could be, spending a little bit of money up front to avoid admissions and situations like that.
Yeah, I mean, it's been a real frustration for us because Apple Health has turned on the physician dashboard, and there's about 500 hospitals that are using it, including ours. So where we can see anything that the patient wants us to see on what they're tracking that directly relates to their health. But every time we've tried to submit a bill for looking at that data, it's been rejected by just about everybody.
Okay, yeah, I could maybe take a look at the remits and see what that's getting kind of into the revenue management, but that might be a place to start. Look at what codes are if it's rejecting or denying, want medical necessity, or they want documentation. Sometimes these things, it won't tell you, but they're looking more for I want to say, additional documentation, or perhaps a modifier. But definitely we could, if you tried to bill it and have a code that it is getting kicked back, that's a great starting place. I don't know if anybody's
Katie,
on in the from that revenue department this morning with us.
I think so. But Katie, you had a comment?
Yeah, I was going to say, so a lot of our implementation groups, we do meet separately, and this is kind of leading into the rest of our agenda for today. Because we are restarting this group, I will go ahead and work with both of you to determine your schedules, and we can decide on a time to meet and start discussing this further. I will also go ahead and reach out to David and let him know that we're going to start this group back up. So keep in mind, I'm support. So I'm here to help you guys. I can help organize meetings, take notes, and do some background investigation if there's anything you want me to look up. So I'm a resource, use it. Just a reminder. So yeah, I will email both of you after I email David, and we can work on a just finding a time to get together and discuss this further and what our next steps will be. Does that sound okay?
That's great.
Awesome.
Thank you so much, Katie.
Yeah, absolutely. On that note, some of our meetings are going to change just because we've realized that there's like too much overlap with our healthcare sector in general, and we've got these implementation groups, and a lot of the information is very repetitive. So we wanted to make you all aware that our sector meeting, the healthcare sector, will be meeting bi-monthly. However, our smaller curriculum groups, the two that are already established, I apologize if you hear my cat yelling. On this note, she's getting louder. Our Just Walk group and our curriculum group are going to be meeting quarterly now. Jay, am I forgetting anything on that? I think we've
No,
determined
I think
our
that, yeah.
okay. Our Just Walk group is meeting next month. So our first meetings of the year will start on March 4th at 8:30 a.m. Keep an eye out for a calendar invite if you're involved in that group. If you are not and you want to be, let me know. I posted my email in the chat. However, our curriculum group, we have not determined when we will start meeting. I will get together with Jay and we'll figure out a time. Hopefully we'll start meeting next month as well. But we just wanted to make everyone aware in any of those implementation groups that we're changing the schedule. We just don't have anything we're actively working on. And as Jay mentioned, there's already been a lot of success. And until we can offer more, we don't want to overbook everyone, just, to just be meeting and giving updates and not anything substantial. So.
And the curriculum group, if anybody's got ideas, I mean, we're happy to get back to implementing stuff, but kind of where we went with that was the education part, like educating the educators. And we did some of those things. And I think it made a little spark, or it helped with the spark, or it continued the fire that was already lit for some people. But yeah, the thing on that one, if anybody's got any connections or anything, I would really like to get nursing school, PA school, pharmacy school, things like that involved. So if we just haven't had, we've reached out to people, haven't had a lot of success in getting them to join in and talk with us, like one visit from some nursing school folks, but they haven't kind of continued with that. So those would be some kind of helpful things for the curriculum sector. But yeah, the other thing, so ultimately, so again, I've been throwing out this idea of kind of revamping the strategies and stuff. And Katie and Robin and I talked about maybe having a small group situation where we actually like set aside some time, sit down, brainstorm, go over these, and see if we can come up with any changes or any new implementation ideas. So
Hey, Jay.
people are, yeah.
Ed Kramer here. Hi, everybody. I can certainly do whatever we need to further connect with the PA program. I'm still medical director of the PA program at UMKC until June 30th, when I retire from that. And also nursing. I just recently met Amanda Grimes, who does, I think you folks probably know her. I'm surprised if you're not connected with her, but if you need to be connected, let me know. And she does a lot of research on physical activity and health and that sort of thing. So two areas where I may be able to help.
That would be awesome.
I think didn't we have some of the residents on during that particular sector when we were kind of getting feedback from some of their challenges with the education piece? I thought we had some meetings with them in that smaller group initially, but I think you're saying it's kind of petered out, or kind of not. We need to reinitiate that with
the residents and the students. They were definitely involved for a meeting or two. But yeah, and the curriculum part, it's not just the med school. So doing it during residency and stuff like that, I think that has been another piece that, again, we've gotten some things off the ground, especially at UMKC with that. But we've just, at times, people have kind of fallen off the group a little bit. So we just want to make sure everybody's back involved, and getting some updates from those groups would also be great.
Yeah, Amanda's great. I know she's worked also on a lot of grant functionality. So she's real familiar with that piece of it too.
Yeah, and I think so. One other thing that Katie had put on our agenda. So currently there's no true active implementation projects. There's nothing kind of in the works that's requiring like our hands-on stuff. And I don't think there's any funding left for the healthcare sector, or is it the whole KCPA plan implementation project, or just the healthcare sector's done?
Every sector, the entire plan. We
Okay.
do not have any more funding to provide. We are working on garnish, or we're looking at trying to get more essentially, but we don't have any updates to provide when that will be.
So that is another hard part about some of the implementation projects, because they do require a little bit of dough to get started. But yeah, so it's being worked on. But if anybody is interested, so sorry, I gotta run off to another meeting here. But if anybody is interested in doing a little brainstorming session, I don't know if we're going to do it for the whole KCPA plan or just each sector individually on their strategies. But I think we're gonna try to set something up for, again, kind of redoing some of those strategies, looking at them again. So.
Oh, Jay, I can finish up. I know you have to go. Thank you so much.
Okay. Awesome. Thank you all for coming. Appreciate it. Sorry, I just got a real like regular job work meeting that I gotta go to. So sorry.
Bye.
CJ.
Bye.
Thanks, James.
Well, I won't take up too much more of your guys' time, but as Jay was mentioning, so essentially our sector is looking to revise our strategies to make them more relevant to current focus is that maybe you are involved in related to physical activity and healthy lifestyle behaviors. So we are trying to gather a small group to revise what current strategies we do have and see if we would like to adapt those. So earlier I had posted more summarizing our strategies in the chat, and then as well as the link to the healthcare sector of the KCPA plan if you would like to look at those strategies further. If you are interested in being a part of the small group, let me know. We haven't decided when we're going to start this process, how it looks. So that's all still kind of in the works. We're just trying to gather who would be interested in assisting us with this task. We don't really have any other updates related to the sector itself. There are a few other outside updates related to the KC-HLC initiative. We actually have a quarterly meeting coming up, and we wanted to share that information as the topic is related to obesity medications and pediatrics. This is a free meeting. Our presentation, you are anyone's welcome to come. If you have students, send them this invitation. It's going to be at the Kauffman Foundation Center, Meeting Center. So I'm trying to copy and paste at the same time. I'm terrible at multitasking. The title's in there, as well as our speaker, who is Dr. Brooke Sweeney. She's the medical, wow, I am so sorry. Medical director for the Center for Children's Healthy Lifestyles and Nutrition at Children's Mercy. So if you are interested, I'm posting the registration link in the chat. And I don't think I mentioned the date. It's Wednesday, March 18th at 9 a.m. This meeting will also be recorded, and it is hybrid. So if you can't attend in person, no worries. Just make sure to click the virtual option. Okay, I think that's everything.
Yeah.
Um,
She really knows what she's talking about. I mean, I work with her, obviously. I work with her, but I'll be in clinic, but I'll be thinking about it. But if you're interested in the medicine, she does adult. I mean, she's med peds like me. So even though technically she does it in kids, she's been doing it in kids for a long time and kind of pushing the barriers.
Thank you, Elena. We also have another event coming up, but I don't have a lot of information to share at this time. It is a conversation around Kansas City youth sports. It's a roundtable discussion, and it's preparing for the global spotlight related to the World Cup. That will be April 8th. It'll also be at the Kauffman. But at this time, there's not a registration form. So if you are interested in learning a bit more, again, my email is in there. Go ahead and email me and I'll put you on a list when I do have more information to present. That will also be a free event.
Will
That
that
is-
also be in the morning?
Probably. I think it's gonna be start in the morning and go through like later afternoon, kind of similar to a previous meeting we hosted around youth sports and community conversations with the Aspen Institute. So yeah. Hopefully it'll be hybrid though too, so you can jump on for sessions that you're interested in attending. On that note, though, that is all the information I do have. I know it's past 11:30 and we were trying to keep this meeting short. So I do apologize. But is there any information or related to your institution you would like to share? I know we kind of briefed over our implementation groups, so we didn't really talk about what was happening at KU or UMKC related to curriculum updates or any of the Just Walk programs at like UMKC. Before we jump off, did anybody want to share anything?
Katie, if you don't mind, I'll just introduce myself real quick because I came in late.
Yes, thanks, Ed. No
And,
worries.
Yeah, there are a few folks I'm not sure I've seen before. Ed Kramer, family doctor, clinically retired, but been affiliated with University Health, UMKC School of Medicine and Family Medicine Department, along with Dr. David Varan. Good to hear your voice, Dr. Varan, earlier. And I also see Meredith Cantrell on the call. Hello, Meredith. And I'm currently working as medical director of the UMKC PA program, and otherwise mostly retired, and but have a fairly good network of contacts around the metro area, I would say. So maybe I can help with connecting people. So thank you. Good to be with you.
Thanks, Ed.
Nice to meet you.
Okay, well, if that is it, just a reminder, we are now meeting bi-monthly. I have it on here that our next meeting isn't until April 14th. I need to double check that. But you should have already received a standing calendar invite for each of the healthcare sector and general meetings. So it should be on your calendar. If you didn't receive those, let me know. I will go ahead and forward that invite. Okay. Well, on that note, everybody enjoy the rest of your day. Thanks.
Thank you. Bye-bye.
Bye.